and without any technical. My father was engineer, and he told me, "Oh, you are technically an analphabet. You don't you don't know anything about it." Of course, we need to start with history, as Professor Suleiman said. Where should we start from? And we have to start from history. Now, I wasn't good at history at all in my school, because I have two problems. I didn't remember names, and numbers without logic order I could not remember. So I was really bad in history remembering this. It doesn't mean that I have a nominal aphasia or calculia as a problem, but simply I do not remember that. But on the other side, I like historic movies and historic books with pictures. I just want to go in that period by my imagination, to think, to try to reach what people in that period, in that environment, think and how they act, what they feel. Unfortunately, not unfortunately, but I had on the first European Symposium on Hijama to speak about history of bloodletting and cupping in general, and that fate follows me completely now. So now we are going back in there are a few reasons to going back to history. I didn't remember whole sentence, which famous sentence. I only remembered Historias Magistra Vitae. But if history is teacher of our life's teacher, then after listening lectures, I used to ask questions. This is Cicero's sentence, which I remember only, Historia Magistra Vitae. And if she is my teacher, I want to ask two questions. Why bloodletting and cupping was performed since ancient time and all over the globe? And second is why it was very popular in some periods and sometimes it was criticized and even banned. What were reasons for ups and downs? From my personal history, before starting to speak, my mathematician teacher say, okay, before analyzing this function, we have to give definition. In medical encyclopedia, last one, which was published in this area from Yugoslav Academic of Science and Art, bloodletting, or on Latin missio sanguinis, is procedure of elimination smaller or bigger amount of blood from body in therapeutic purpose. There are two kinds: general bloodletting by venesection or venipuncture, local bloodletting, either with vacuum cups on scarified skin or by leeches. Blood suction, on the other side, is drawing blood by vacuum on the surface of the body, by horn, by cup, and the cups are small vessels in which air is diluted by heating or by rubber balloon or pump now, contemporary. Cupping therapy can be done in two ways. As dry cupping, so-called, that means without bloodletting, or wet cupping, when vacuum cups are put with skin scratches. There was an article published in French History of Medicine, French Journal of History of Medicine, where Pierre Brissot gave interesting title, Bleeding in Medicine, a very long story that it is not over yet. I know this is very long till you start here, but very soon it will be coffee breaks. So we start, but didn't finish yet. It is interesting, maybe history is telling something to us. Pierre Brissot is writer of this article in 2017. Pierre Brissot was a name of a French physician in 16th century whose fate was very sad because of his way of bloodletting when he opposed standard medical opinion and was even exiled from his country. Historian of medicine, Dr. Sigerist, said that bloodletting and cupping are one of the oldest therapeutic procedures. So it could be said that every primitive society developed its medical practice on instinct-based reactions. Bloodletting as a method of treatment is so universal that it had to be derived from instinctive actions, although observation of its beneficial effects probably influenced the quick and rapid development of this method. After insect bite, yes, we scratch our skin. It is some reaction to protect ourselves. Also, after ancient practice of making incision at the site of snake bite is also effective. Sucking of our skin in childhood was almost act of every child. I asked short survey I made with 10,000 people, and only 3 of them didn't remember when we suck as a child, our skin. We said we made watches on our skin. It is some instinctive reaction. It gives us some pleasure or some benefit. That's why from 10,000 people, only 3 did not remember. So if we scratch skin and if we suck our skin, yes, in other case, Dr. Sigeri said over time, scratching with nails turn into scarification or notching. And sucking turns into vacuum practice. We have seen that first documents were in Egypt. It was from former presentation. I asked a question for award. Do you know where first recorded pictures and of cupping? And for help, I gave picture of pyramids. Answer of our people in the room were Visoko. You don't know maybe that we have near Sarajevo. Yes, Professor Wad, you are interested in history. Near Sarajevo, we have Bosnian pyramid, and I think you will go there. So it was not Visoko, it was Egypt, but all over the world in medical system, which was developed in civilizations, bloodletting and cupping was performed. In Ayurvedic medicine, in Africa, both Americas, in Japan, few methods of bloodletting were, but Ranshi Ho was most similar to Hijama. Of course, in China, the big system of cupping is made. But let's go back on our theme on Mediterranean region, where we know that ancient Greek considered that veins carry blood and arteries pneuma. So they done venesection for problems with blood. 2 key concepts: blood is created, but also consumed. And the second concept of humoral balance of fluids, which is now accentuated and renewed again. Hippocrates recommended bloodletting from a vein in the beginning of severe acute disease. He was familiar with local bloodletting, Hijama, similar method to hijama, and leeches. Ancient Roman nobleman who wrote big encyclopedia, Cornelius Celsus, he recommended the vein section, leeches, and cupping. Galen, one of the pillar of medicine, he recommended almost in every situation bloodletting. He made complex scheme of how much blood should it be derived, age of patient, constitution, season, and so on. But in that time, many people, as always in history and today also, many colleagues opposed this therapy. And there are a group of physicians who followed Erasistratos, who was against bloodletting. It infuriated Galen so much that he wrote the book for venesection. Pre-Islamic Arabs had the same type of medicine because of, it was, as Professor Rida said in history, it was center when they collect knowledge from East, from India, from Egypt, from ancient Rome and Greek. An organized state union of Muslims was formed in Medina and managed directly to the Prophet Muhammad sallallahu alaihi wasallam. Prophet Muhammad points out to his followers hijama, method of healing by cupping and releasing certain amount of blood. Numerous hadiths remained recorded about this. Prophet explained the way of application and implementation of this method, indication, and the most appropriate time and period for performing. So hijama becomes special, particular method within and among the previously known treatment of bloodletting and cupping. And second, it becomes sunnah of Prophet or tradition of Prophet sallallahu alaihi wasallam. It is interesting that on our first European Hijama symposium, Professor Ljubor Ristovski, professor of biophysics in Belgrade School of Pharmacy, said what distinguishes hijama from other alternative medical system is indication of the dependence on circulunar rhythm. And the validity of this recommendation is also indicated by modern research in chronobiology. Professor Ristovski 16 years ago said that, by his opinion, hijama is the most, what should be called holistic and adequate alternative medical treatment because of many reasons. In Ibn Sina, second pillar of medicine, wrote about bloodletting. His canon was official medical book in Europe. Al-Zarhawi in 10th century speak and made instruments for bloodletting. He made a scheme where to do venesection. Islamic medicine was transferred to Europe over Spain and Sicily, and in 14th century by Turks on Balkan region. In the early Middle Age, bloodletting in Europe was done mostly by monks. Saint Hildegard or Hildegard von Bingen was one of the rare female polymath. She wrote books in botanic, medicine, and theology. She was advocated cupping and bloodletting in other ways by leeches or venesection. This, we are not going to read all of this, but she advocated to do it on empty stomach. It will be useful in every period. Excuse me. It is more beneficial for young people than to older. For fat people, she said that it could be done even twice a month. For those thin, a monthly if necessary. And there are many indications for each disease and the medical problem. But in Papa Pope Bonifacius VIII forbade priests and monks to perform medicine in general, and bloodletting and cupping went into hands of barbers who performed the bloodletting in baths by cups and leeches and venesection also. In the late Middle Age, venesection passed again from hands of barbers to doctors. The famous Salerno school developed in south of Italy, and Giovanni de Aquila, one of the famous doctors from Salerno school, made recommendation about doing wet cupping, and it is in fact hijama because it came through Arab doctors on Sicily. In 16th century, look at these names and try to both. Supporter of bloodletting were Paracelsus, first professor of chemistry who became professor of medicine, and he is best known as alchemist. Ambrose Paré, father of modern surgery. Vesalius, who wrote the famous anatomic book of anatomy, 7 books of the fabric of human body. But the struggle happened to Pierre Brisson. As I told you before, he opposed Arab method, which was dominant in France in that time, by performing Hippocrates way of doing venesection. In that way, he was declared by Paris Faculty of Medicine as medical heretic. And that kind of his bleeding or Hippocrates bleeding was forbidden by act of French Parliament. So don't worry if in some countries are now still hijama, not official method. Brisson was exiled to Spain and Portugal and died in exile. Even his method was effective and show effectiveness during epidemic. So this is also Pierre Brisson, who wrote 500 years that bleeding in medicine, very long story. In 17th century, Thomas Widenheim was used venesection for almost all diseases. He was called English Hippocrates because of his book, which were official books for learning medicine. In Dutch botanist and physician, father of modern physiology, also recommended bloodletting and cupping. George Amstel, German chemist, physician, and philosopher. French doctor Brisson became one of the first members of Academy of Medicine, which was founded in that year. He advocated this method of all methods of bloodletting. And he was especially fond of leeches. So in 1 year, in his department, he used 100,000 of leeches. It was interesting that it was so famous in France in that period that it was calculated 33 million leeches were imported, and something about 22 millions of leeches were domestic product. So in one magazine in France, they calculate how much they spent in that time money, because price of one leech was 10 cents, and they spent 5.5 million of francs on leeching. Not only in France, but in other countries, in a movement against bloodletting emerged in the middle of 19th century. For example, some opponent as Skoda, Wien clinician, he was opposing this method completely. At the end of the 19th century, physicians almost completely put away this method and left it to barbers. One great physician in Russian science, Pirogov, who was pedagogue, public figure and member of Russian Academy of Science, he advocated venesection in brain injury. New period, the rehabilitation of venesection in the late 19th century is done by German physicians. Leeches, which had been also neglected in that period for a long time also, experienced a new boom after discovering hirudin, active substance from the saliva. From barbers, one step was formal education for surgeon. As we know, in 19th century, surgeons were not medical doctors. Only recently they accept us. It was some special occupation, which vocation for which they need education, and this is standard complete of the for therapy. In Serbia, Dr. Sremac, it is like family medicine, kućevni lekar. He wrote about kupice se meču suhe I krvave, cups are put dry and bloody or wet. So he explained this method completely because through Turks, our method of hijama came on the Balkan. This is interesting that in America, it was revisited, entirely remodeled and augmented with theaters of minor surgery, old book from French author, but in 1923, in this book, entitled Third by Elementary Operation, in first chapter, there are titles about bleeding or emissione sanguinis. There is about local bleeding, about leeches, and bird peck punctures. First time I have bird peck, and scarification. If we say that it is 100 years ago, they had complete definition of all this method in official textbook, which was edited many times. And if we said, oh, it was 100 years ago, maybe it was primitive medicine. But in that time, when we compare what medical achievement, I'm comparing it in neurosurgery. For example, Harvey Cushing in that time performed 2,000 brain tumor operations. So it was not primitive medicine, it was very advanced. In 20th century, German physician, John Ebel, wrote a book about reflex cupping, and it is kind of reflex zone therapy. This was a specific way of performing hijama and was done in German-speaking area. In leeches also get more indication in hirudotherapy now than ever before in their history. In our medical encyclopedia, we had this, there is bloodletting, especially, and cupping described the indications, way of performing, and it is said, Professor Suleiman, that it is triple S. First suction, cups, then scarification, and then cups. It is described in 1917 latest medical encyclopedia. So that means that hijama never stopped being medical method in this area. Maybe recently we just didn't perform it, but it is medical method, and that we don't have to advocate it at all. So my history teacher answered me about two questions. Bloodletting and cupping was performed all this time because it is universal therapy which provide activation of our ground regulation system, which maintains balance or homeostasis. It was very popular in some periods when prominent physicians and scientists used the treatment method, explaining and proving its benefits. What were reasons for up and downs? Whenever bloodletting or cupping was done by half-educated medical professionals, or even dilettante, Interest for this method decreased and had many opponents. For the end, before coffee, look at this great scientists. All of them were doing, explaining, and advocated cupping or hijama therapy, in general, bloodletting. So we know three fundamental works and fathers of medicine: Galen, Hippocrates, Ibn Sina, Al-Zarqawi, father of modern surgery, Hildegard von Bingen, Polymath, Giovanni de Aquila, Padova, Salerno School, Paracelsus, father of toxicology, Ambrose Pere, father of modern surgery, Vesalius, father of anatomy modern, Thomas Sydenheim, called English Hippocrates, Ernest Stahl, chemist, physician, philosopher, Brescier, member of Académie de Medicine, but not only in France, he was associated member and correspondent member of Academy in America and few in other countries in Europe. For him, it was interesting that from China, they sent him letters, put his name and put Europe just as address. They know letter will find him. And thank you for your patience.
Thank you all. Now it's time for well-deserved coffee, but just before you go, we want to emphasize that doctors who practice hijama and scientists who study the effects of hijama on the human body have joined their strengths exchange experience, and in 2021 they have founded the International Association for the Study of Hijama, whose co-founder is also Dr. Omerhodžić, together with university professors of medical studies from Egypt, Saudi Arabia, Turkey, and Great Britain. Thank you all.